Hi, I'm talking to Osteopath Oliver Gordon today. Hi, Oliver. How are you?
I'm very well, thank you. Hi, Joanne.
Hi. Oliver, we've spoken about various aspects of osteopathy in previous interviews. Today, let's talk a little bit about specific back pain. What can you tell me with regards to back pain?
Well, with regards to back pain, it's probably the most common thing that we see. I mean, the statistics say that 85% of the world population will suffer from back pain at some point in their lives. And with regards to seeing the doctor, particularly in the US and the UK, back pain is the highest reason for patients to come and see the doctor. They think something like, and the highest reason for people to be absent from work. So there's many statistics about how much money businesses are losing as a result of all of this back pain. And we as osteopaths are experts in back pain and understanding back pain and diagnosing it and treating it. So this is part of it, and they reckon that 4 in 5 people that you ever meet, they're going to have back pain. This is a lot. It's the only thing.
Sorry, so what would happen if somebody came to you with complaints of back pain? What would your initial consultation be?
We would do the normal case history, observation, examination, and then we would go on to inform the patient as to what was the problem, what was the real specific area that is causing this, obviously depending on how acute they are. We would do everything within our power to help them. Sometimes it takes, let's say, 3 or 4 sessions, but you're not going to put too much medicine into yourself unless it's really necessary. And therefore, the rest of your body can heal and help the healing process even quicker. This is the philosophy.
What specific techniques, name 1 or 2 that you would use on somebody with chronic back pain?
As I've said previously, I use a range of techniques that are from manipulations, the clicking noises that you hear, the chiropractors use these techniques, to soft techniques, stretching techniques, harmonic techniques, that generally what the patient can handle and relative to their problem and relative to their pain. I think this is being a bit more specific to people. Everyone is very individual, and they have their own feelings of pain even, so which is another subject on its own. But I think with regards to back pain and my experience of people with back pain, I think that it's a management program that we create for them. There are many lifestyle changes that can be implemented. For example, changing the ergonomics on your workstation with your computer, adjusting your chair in order to sit properly, especially if you sit in it all day in an office. Things with headsets such as this, which are very useful rather than holding the phone. These are very general pieces of advice that help to prevent people having problems in the first place. And I think this is part of osteopathy, is to help prevent disease or dis-ease, as we would call it, which many people experience even before they have any real problems or pains. So I think part of our job is to get out there and tell people about it.
So I think you raise a very interesting point that what I'm hearing is that, obviously when you come to the osteopath, you will do these techniques in the actual consultation, but there's going to be certain things that the person needs to do at home or at the office to help maintain and improve the pain of their back.
I think what I say to the people that I see is that I see someone for maybe 40 minutes or an hour in their life. I'm like a catalyst for them to change. So I push them in the right direction with all my techniques, with manipulation, with muscle stretching and relaxing. And then on top of it, I try and keep that all together and say, well, now that you're in a better balance, let's try and keep it with doing some things in your life that maintain that balance. So there's many people that come and see me, not just for their problem, let's say back pain is where it starts, but actually afterwards they say, actually this is really good to help relieve me of my monthly struggles or my weekly or bi-weekly struggles with my body. And I think that now with modern life being very stressful, very quick-paced, our bodies tend to take a bit of a pounding from life itself. And I think osteopathy provides a bit of relief on the way and a good way to maintain the body. So exercises, specific stretching, lifestyle advice, some diet advice is often relative to someone's problem and relative to their long-term management of their body.
Just a final question with regards to the back pain. If somebody's taking medication, painkillers, does the osteopath agree with that, or do you tell them to come off the conventional medicines? What are your thoughts with regards to that?
I personally try to work with the doctors. So if they have prescribed medicine, I think it's there for a reason, and it does provide some relief, generally. But I think to myself that the osteopathy really gets to the bottom of the problem rather than hiding any symptoms. Whereas things like painkillers can often hide the problem, and it just provides like a distraction for the body. I think osteopathy really gets to the anatomical structures that are causing the problem, and we relieve those. So the pain-killing medications can be helpful for the person to live their life, and the treatments are there to provide actual, let's say, a cure for the problem.
Thank you, Oliver. Thank you so much.
Thank you.